Abortions in India and worldwide have always been complex, from matters of agency, stigma, legal provisions, and access to providers. Even in normal times, this decision is a complex, challenging, but always a thoughtful one. The COVID-19 outbreak has accentuated what were always challenging circumstances: an overstretched health system, the risk of COVID-19 being omnipresent, severe mobility restrictions, supply chains being disrupted. And imagine amidst all this having an unintended pregnancy and not being able to access reproductive health services. A modeling study done by the iPass Development Foundation estimated that access to 1.85 million abortions may have been compromised just in the first 3 months of the lockdown. Now, the impact of a crisis is never equal. Women, children, the differently abled, gender minorities, vulnerable communities all bear the burden in different ways. In the next couple of minutes, our experts outline the many different ways in which this pandemic has restricted women's access to a service that is so time-sensitive. Anjali Nayyar, the Executive Vice President of Global Health Strategy, setting up the big context and the big picture. Dr. Nozer Sheriar on the challenges faced by providers, especially at a time when this pandemic has posed an unprecedented burden on the health infrastructure of our country. Vinoj Manning, the CEO of the iPass Development Foundation that carried out the modeling study on the compromised access and why, despite it being made an essential service, there were huge challenges. Shankar Narayanan, the Managing Director of PSI India Private Limited, on the supply chain constraints. And finally, lawyer Anubha Rastogi on the legal framework.
A recent report by Guttmacher Institute revealed that if 10% of safe abortions, only 10% of safe abortions became unsafe because women cannot access clinics amid clinic closures and lockdowns, there would be an increase of 3 million unsafe abortions and at least 1,000 more maternal deaths next year. Similarly, an article by Madhukar Pai, a leading epidemiologist from McGill University, talks about the modeling that was done by UNFPA, showing estimates that between 13 to 51 million women in 114 low and middle income countries will be unable to access modern contraceptives, depending on the length of the lockdown and the level of service disruption, leading to an additional 325,000 to 15 million unintended pregnancies. So we can just see the impact that's done.
If you go by numbers, in the first month of lockdown, you had 2 million births in India. In the second month of lockdown, another 2 million births in India. In normal times, in the first month of lockdown, we should have had 1.2 million abortions in India. In the second month, 1.2 million abortions in India. And depending upon the extent of disruption, you can understand how difficult it was just to fight to segregate the maternity services and to give those women care. They were petrified, they are afraid. They found it difficult to get to their hospitals. Some of their doctors had closed down their nursing homes and their services. And we were in a situation there. When it came to abortion, my personal experience was that I did run my practice right from the beginning, but in a very restricted manner, because there were a lot of issues. During the lockdown, we're just talking about women's access. It was difficult to keep services going because it was difficult for staff to access and come to services. There was difficult for supplies to be made available. So when everything shut down, everything gets disrupted. My patients did reach out to me and come to me, but a lot of them waited for the first lockdown to get over. And then they waited for the second lockdown to get over. And for me, at this time, I've had a few more surgical abortions than I would have normally done, because women who would have always opted for medication abortions came to us late because they decided to wait out the lockdown, hoping that the first one and then the second one and then the third one will get over. Now, in the background of all this, you have to understand a lot of women and couples came to us in the past privately with full confidentiality. When you're locked down at home, sometimes with extended family, how do you justify getting out of the house to go to the chemist, to go to your doctor, and that became a barrier as well.
If you look at public health facilities during this period, around 77,000 abortions got compromised. Key reason being key public health facilities at higher levels were repurposed to be purely COVID-19 treatment centers. Some of the providers of abortion care got deployed along with facility staff from the regular work to COVID care, and obviously mobility restrictions for women due to suspensions of public transport. When it comes to private health facilities, close to 300,000 abortions got compromised. In addition to mobility issues from the women's perspective, there were quite a bit of closure of private hospitals and clinics that were reported, or lack of providing contact services. And that primarily, they said, was unavailability of protective gear at the beginning of the time for providers, lack of mandatory. They wanted to do COVID-19 testing, but they didn't have the testing arrangement, and inadequate availability of providers to come into these facilities. So all these together led to compromise in the private health facility.
Even in pre-COVID days, access to medical abortion continues to be hampered through several barriers. So number one, it's always not convenient access. To illustrate a point, we have now reached 98 to 99% access for condoms, right? So 99% of close to around 1 million chemists have condoms, which is roughly speaking 5 minutes walking distance from Rukmani's house. That's not the case for medical abortion. Medical abortion continues to be constrained by rules and regulations. It's also not stocked in a large amount of quantity. Most of the medical abortions stocked at the chemist counter are without bills because of increased regulatory scrutiny, specifically in some states like Maharashtra, Rajasthan, and Haryana. So it's not convenient access even during pre-COVID days, and this constraint was totally hampered during the 4 phases of lockdown. So we estimated lost sales of close to around 1.5 million combination kits. A kit in India travels around 3,000 kilometers from production to use. So to illustrate the point, if it were to reach a chemist near Rukmani's house, it would travel around 3,000 kilometers. Roughly, it would take around 90 to 120 days from production to the chemist counter near her house. And it would travel along 3 or 4 state borders, 3 or 4 warehouses, and it would reach the chemist near her house. On March 24th, that chemist closed. Now, assuming that the chemist had medical abortion, the chemist was not available for procurement. If the chemist didn't have the medical abortion kits, then the supply chain couldn't get the drug from point A to point B. So you had restricted supplier mobility. User mobility was severely restricted, at least in the first 40 days of the severe lockdown that India witnessed. The second barrier is, one of the things that we have learned over the years is it's not Rukmani who usually makes the purchase. It's a partner or a husband who usually comes to the chemist counter and makes the purchase. Takes around 5 to 10 minutes. It's usually not in the neighborhood chemists. Abortion continues to be grappling with stigma, and people want discreet and on-demand services. Most of the procurement happens in chemist counters where there is no familiarity.
Sitting in Bombay, where I am in my house, I have been able to assist someone in another city who was 7 weeks pregnant, but she was minor. And she and her mother were, had to run from pillar to post to first get the FIR registered, then get a copy of the FIR, then convince the doctor that nothing more is required. Then they had to go to some other center, so just even, and with all of this, the whole COVID situation is going on. So I think, in any case, there were so many barriers from the point of view of law, even though there is so much that positive that has happened in the past few years. This still continues. The other point that I definitely wanted to make was that as part of the Pratigya campaign, we were earlier tracking cases that have gone to court seeking permission for terminations of pregnancy. We were usually seeing that these were above 20 weeks, but of course there have been various high courts where even cases of 7 weeks, 8 weeks have gone to court seeking permission for termination of pregnancy. And that's a different conversation altogether. But even during the lockdown, I have seen that there are close to 30 cases across the country where Access to justice was a concern because the courts were shut and only urgent and very urgent matters were being heard. There were at least 30 cases, to the best of my knowledge, which had to go to court to seek permission for termination of pregnancy.
So what are the options available? One, medical abortion is primarily an option early in the pregnancy. Because of the delay, some women, if they are still within the gestation period, but still would not be able to access their preferred first point of care service, but would be forced to go to a facility, which leads to itself to various implications, which probably the panel will talk about. The second, the only option left is if the gestation has moved beyond the 12-week period, which means that the only thing she would be eligible to receive is second trimester abortion, which brings in a whole set of complex challenges and barriers for her. The third option would be for continuing in pregnancy, which was unintended and unwanted in the first place. And finally, for those women who are desperate, the only option left would be unsafe abortion.